I'm ready for you one. Okay. So I'd knock on the door, perform hand hygiene, introduce myself. Hi, my name is Kinsey. I'm going to be your nurse today. We have orders to do a Foley catheter for you, just to drain your urine. There's many different uses for this. So I'm going to go ahead and get your name and date of birth. So I would check the name, Newman J. Malice, date of birth, 3/2/1977. Do you have any allergies? Sulfa and iodine. So for this patient, they do have an allergy to iodine, so I would not want to use that cleaner. But for the video purposes, we're still going to use it, but this is not what I would do in a real scenario. So I already have my bed set up how I would like. I'm going to go ahead and kind of get you positioned for it. Some of the cleaning stuff we have to use is I'm going to be cleaning your private parts. This is the black dot. So you will feel me moving them, but I am just cleaning them. If any point you're in pain, it can be a little uncomfortable. So if you're getting uncomfortable, just tell me and we can coach you through some deep breaths and stuff like that. So I would want to have clean gloves on to position my patient. So we're going to kind of butterfly the legs. And I'm going to go ahead and move them all the way down. I would make sure the doors closed, curtains shut, all like that, because this is a pretty not private video and procedure. So I have the legs positioned how I want them. I'd make sure that they're comfortable. So now I'm going to take my gloves off. I will have used purple wipes to clean my table already. I perform hand hygiene again. So my table's clean, dry. I have my sterile gloves already because ours are hidden in the kit. My kit's unopened. So I'm gonna go ahead and open it. And then once it's open, flip it around. And before I get it all the way open, I'm going to set my biohazard bag on this side right here. This will just be to throw my supplies away. Perform hand hygiene again if I needed to. Open my kit, and then we're going to flip it. Paper up. And I'm gonna slide my kit out. Get rid of my paper. Like all the sterile procedures, I'm gonna open away from me first, and our same thing applies with our inch margins. So I'm going to open it, and then I can move it square-wise, and I'll just note my areas of contamination, obviously anything that's falling off the side, and my inch barrier. So now I'm going to go ahead and put my sterile gloves on before I start. Same thing with these, washing my border. And making sure I don't get them onto my other sterile field. Alright, so I can adjust these how I need to. Push them back. Alright, so then I can slide this off, keeping my hands above. So now I'm going to kind of rearrange my tray. I'm gonna scoot it this way a little bit, that way I have room to take the next tray out. Lift this up, and just reminder, being careful of my borders, because once you set both of them out, they do get kind of close, so you just want to be cautious of that. So I'm gonna start with my first one, and I'm gonna set these out of the way before we get too close. So when doing this one, we are probably gonna contaminate since our mannequin can't help us lift the legs, but we're gonna do the best we can. And if I were to contaminate in real life, I would want to make sure that I am switching my gloves out, getting a new pair of sterile gloves, doing whatever I need to. So with this, we're gonna set it underneath. And like I said, we will contaminate doing this, but in real life, I would want to have my patient, and like that part again, contaminated. But in real life, I would ask my patient or have someone help me if it's possible to kind of lift their bottom up. That way I can push that under there without contaminating. And like I said, I did contaminate, so I would want to change my gloves, but we're gonna keep going. With our second drape, this one's gonna go over the peri area. So we're gonna open it, find the shiny side. And so we're gonna go. All right. So same thing with this one. We're gonna have it set placed. And once I have it where I want, drop it. Didn't contaminate with that one. So now that I have my area set up, I can go ahead and start setting up my stuff for the actual Foley calf. I'm going to start by getting my stuff ready, my cotton balls ready. And like I said, I wouldn't want to use the solution for this specific patient, but for the video purposes, we are going to use it. I can throw my trash in the biohazard bag. So I'm going to make sure that my cotton balls are fully saturated. I'm gonna use the full solution. And I can toss this in the trash, keeping my hands above my waist this whole procedure. One thing is I could use my bed up a little higher because it is a little low, which is technically considered below my waist. That is one thing I would like to consider. So now I'm gonna open my lube, which is the blue one. Like I said, getting rid of my trash. So there's a little well for it. I'm gonna put it this way. That way I can set my catheter up. So now I'm gonna open my catheter, and when opening it, we wanna make sure that we hold it. That way it's not wiggling around when I open this blue. So I'm gonna take it and just rip. And the way I'm doing it is I'm kind of keeping it halfway in first. That way it's not moving all the way around. So I'm gonna rip this all the way up, and then I wanna grab the bottom. And I'm gonna hold it like that. Throw that over there. And I'm gonna now set this into my lube and let that just kind of set there for a second. And I wanna arrange it. I'm actually gonna move my tray because I don't want it hitting my iodine. Okay. So there that is. So now for this part, I'm gonna commit my left hand and it's gonna be dirty. So when I commit my left hand, it'll be dirty, so I'll no longer be able to use it. So I wanna get my solution set up first, just to prevent later problems. So I wanna pull back, get the air out all the way before connecting it. I would make sure it's the correct amount, and you wanna hear the clicking, which I do. So now, like I said, left hand's gonna be my dirty hand. So I'm gonna find where I want, and I'm gonna commit my left hand there, and it's gonna stay there for this whole time. And so for my first swab, we're gonna go away from first, just up to down, and I probably shouldn't move my finger, but just to show you the cleaning, I slightly did. So I'm honestly just gonna keep it off now since I already moved it. Throw my dirty away. Then wanna go to closest to me, same thing, up to down. And then for the last one, we're gonna go straight down the middle, making sure we're cleaning well, just helping prevent infection. Throw that away as well. We're done with these, so I'm gonna toss them. You could keep them if you want. So now I'm gonna move my lubed up catheter back to my tray. And I'm gonna move my tray here, and I kept my left hand in place that whole time. So when moving this, in real life, when inserting our catheter, we would be able to see the urine return, and that's how we know we're far enough. But for this, it's gonna be about 4 to 6 inches. And so now I have it in, I'm gonna grab it and I'm gonna inflate. Once we inflate all the way, making sure the balloon's fully in place, I'm gonna disconnect and I'm just gonna toss that there. So now I would wanna tug on it to make sure it's fully in place, which it is. So now I'm done, so I don't have to necessarily worry about being sterile. So my hands would be dirty and already lubed up, so I'm gonna go ahead and just cut this off with my hands. And I'm gonna remove this out. And being careful with it, because it is not taped. So I'm gonna get all my trash and stuff out of the way, and I'm gonna leave this right there. I'm just gonna toss it in my biohazard. I would remove these. Hand hygiene. And then I would put on clean gloves. And I did not grab any tape. We would have a stat lock to use, which would be in our kit, but we do not. So I would want to use tape or a leg secure. So when I do tape it, I'll show you since I didn't grab it where I would want it at. Get these on. So when taping it, I would want to tape it on the thigh area, and I would move their legs back before I did. So we'd want to tape on the thigh, and then when we hang this down, we're gonna want to open it. So that would be taped. I would want to open this up, move this, and we would hang it off onto the side. There's a little rail down here that we can put it on, leaving a little bit of the tubing on the bed. And like I said, this part would be taped. And then we would clean up, position the patient. I would assess the urine color, the amount, make sure that they're feeling okay, no pain, don't need anything, and I would document the placement of it, and I would clean up.